Assalamualaikum warahmatullahi wabarakatuh. Have you guys ever heard or know about a disease that is called Wilms tumor?
Wilms tumor, medically known as nephroblastoma, is a rare type of kidney cancer that predominantly affects children. It is characterized by the rapid growth of a tumor within one or both kidneys. Despite its rarity, Wilms tumor is the most common type of kidney cancer in children, typically occurring between the age of 2 and 5.
The tumor usually originates from immature kidney cells and can be detected through various imaging techniques. Early diagnosis and advancement in treatment have significantly improved the prognosis for children with Wilms tumor, leading to high rates of successful outcomes.
Several systems in the human body can be related to or affected by Wilms tumor. These include first, urinary system. Wilms tumor originates in the kidneys, which are part of the urinary system. The tumor growth can affect kidney function and urine production. And second, renal system. This system includes the kidneys and their associated structures, such as the ureters and bladder. Wilms tumor directly impacts the kidneys, leading to potential complications in renal function and urine excretion. Third is endocrine system. The endocrine system can be indirectly affected by Wilms tumor, especially if the tumor spreads or exerts pressure on nearby endocrine organs, such as the adrenal glands. Fourth is cardiovascular system. In some cases, Wilms tumor may spread to nearby blood vessels or lymph nodes, affecting blood circulation and potentially causing cardiovascular complications.
5. Lymphatic system is Wilms tumor can spread to nearby lymph nodes and lymphatic vessels, impacting the body's immune response and lymphatic drainage. 6. Nervous system is if Wilms tumor grows large enough or spreads to nearby structures, it can affect nervous and nerve pathways, leading to neurological symptoms or complications. 7. Musculoskeletal system. In rare instances, Wilms tumor may spread to bones or soft tissues, affecting the musculoskeletal system and potentially causing bone pain or fractures. 8. Respiratory system. Although it's not directly related, advanced stage of Wilms tumor may lead to respiratory system if the tumor persists again or infiltrates nearby structure in the chest cavity.
9. Digestive system. Wilms tumor, if it grows large enough, can compress nearby digestive organs such as the stomach or intestines, leading to digestive symptoms or complications. 10. Immune system. The presence of Wilms tumor can affect the body's immune response, especially if it spreads to lymph nodes or impairs the function of immune-related organs. 11. Reproductive system. While Wilms tumor primarily affects children, in rare cases it can occur in adults. If the tumor spreads to reproductive organs or affects hormone levels, it may impact fertility or reproductive health. These systems can be affected either directly by the tumor or indirectly through its effects on adjacent structures or systemic functions.
The exact cause of Wilms tumor is not fully understood, but several factors may contribute to its development. First, genetic factors. Wilms tumor can sometimes occur due to genetic mutation or abnormalities. Certain genetic syndromes such as WAGR syndrome, Wilms tumor, aniridia, genitourinary anomalies, and mental retardation, and Beckwith-Whiteman syndrome are associated with an increased risk of developing Wilms tumor. Second is prenatal factors. Some cases of Wilms tumor may develop during fetal development. possibly due to abnormal kidney development or exposure to certain substance in utero.
Environmental factor is one specific environmental factor linked to Wilms tumor are not well defined. Exposure to certain chemicals or toxins during pregnancy or early childhood may play a role in its development. Family history. In rare case, a family history of Wilms tumor or other kidney cancer may increase the risk of developing the disease.
5. Gender and age. Wilms tumor primarily affects children with the highest incidence occurring between age of 2 and 5. It is slightly more common in girls than boys. 6. Race and ethnicity. Wilms tumor incidence varies among different racial and ethnic groups, with higher rates observed in African to American children compared to other racial groups. It's important to note that Wilms tumor is a complex condition and the interplay of genetic, environmental, and developmental factors likely contributes to its development in individual cases.
Symptoms of Wilms tumor can vary depending on the size and location of the tumor, as well as whether it has spread to other parts of the body. Common symptoms may include abdominal swelling or mass. One of the most common signs of Wilms tumor is a painless swelling or mass in the abdomen, which may be noticed by parents or caregivers during bathing or dressing. Second is abdominal pain. Some children with Wilms tumor may experience abdominal pain or discomfort, especially if the tumor is large or pressing against nearby organs.
Blood in the urine. Wilms tumor can cause bleeding in the urinary tract, leading to blood in the urine. This may appear as pink, red, or colored urine. 4. High blood pressure is hypertension. In some cases, Wilms tumor can lead to high blood pressure, also known as hypertension. This may be due to compression of blood vessel or hormone obstruction by the tumor. 5. Fever. Children with Wilms tumor may develop a fever, which can be a sign of infection or inflammation associated with the tumor.
6. Unexplained weight loss. Rapid or unexplained weight loss may occur in some children with Wilms tumor, particularly if the tumor affects appetite or metabolism. 7. Fatigue. Children with Wilms tumor may experience fatigue or general weakness, which can be attributed to the body's response to the tumor or associated symptoms. 8. Other symptoms. Depending on the extent of the tumor and whether it has spread, additional symptoms may include nausea, vomiting, constipation, loss of appetite, and respiratory symptoms if the tumor spreads to the lungs. It's important to note that these symptoms can also be associated with other medical conditions, and the presence of one or more symptoms does not necessarily indicate Wilms tumor. If parents or caregivers notice any concerning symptoms in a children, they should seek medical evaluation and guidance from a healthcare professional.
Treatment for Wilms tumor typically involves a combination of surgery, chemotherapy, and sometimes radiation therapy. The specific treatment plan depends on factors such as the stage of the tumor, the child age, and overall health, and whether the tumor has spread to other parts of the body. Here's an overview of the main treatment modalities. First, surgery. The primary treatment for Wilms tumor is surgical removal of the tumor and affected kidney, nephrectomy. In many cases, only the affected kidney is removed unilateral nephrectomy, especially if the tumor is confined to one kidney and has not spread. In cases where the tumor has spread to both kidneys or both nearby structures, a more extensive surgery may be needed. Second is chemotherapy. Chemotherapy is often used before or after surgery to shrink the tumor, reduce the risk of recurrence, and treat any cancer cells that may have spread beyond the kidney. Chemotherapy drugs are typically administered intravenously or orally and may be given in cycles and overall several months.
Third is radiation therapy. Radiation therapy may be recommended in certain cases to target and destroy cancer cells that remain after surgery or to treat tumor that cannot be surgically removed. Radiation therapy is usually reserved for advanced or high-risk Wilms tumor. Fourth, biopsy is in some cases a biopsy removal of a small sample of tissue may be performed before surgery to confirm the diagnosis of Wilms tumor and to help determine the most appropriate treatment plan.
5. Clinical trials. Children with Wilms tumor may be eligible to participate in clinical trials evaluating new treatments or treatment combinations. This trial aims to improve outcomes and reduce side effects associated with current treatment approaches. 6. Follow-up care. After completing treatment, regular follow-up visits with healthcare providers are essential to monitor for any signs of recurrence and to address any long-term effects of treatment. The overall prognosis for children with Wilms tumor is generally favorable, especially when the tumor is diagnosed and treated at an early stage. However, the specific treatment approach and prognosis can vary depending on individual factors, and close collaboration between healthcare providers specializing in pediatric oncology is essential to optimize outcomes for children with Wilms tumor.
In conclusion, Wilms tumor, also known as leproblastoma, is a rare but significant type of kidney cancer that primarily affects children. Despite its rarity, it is the most common type of kidney cancer in children, typically occurring between the age of 2 and 5. While the exact cause of Wilms tumor is not fully understood, it is believed to involve a combination of genetic, environmental, and developmental factors.
Early detection and advance in treatment, including surgery, chemotherapy, and radiation therapy, have significantly improved the prognosis for children with Wilms tumor, with high rates of successful outcomes. Close collaboration between healthcare providers specializing in pediatric oncology is essential to optimize treatment and long-term follow-up care for children affected by this condition. Ongoing research and clinical trials continue to explore new treatment approaches aimed at further improving outcome and quality of life for children with Wilms tumor.
I'm Inana Shafina binti Rahman.
I'm Adana Shafila binti Azudin.
I'm Patricia Marquez-Martin Norski
We are students in
Biomedical Electronic Engineering Therapeutic
from KKTM Medan.